Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: how long does Adderall stay in your system? What is Adderall? Adderall is a medication that has become increasingly popular for treating ADHD, attention deficit hyperactivity disorder, and narcolepsy. As a stimulant drug, it can help improve focus and concentration but can also have potential risks and side effects. When taking this drug, one of the most common questions is how long is Adderall in your system? Knowing how long Adderall remains in the system can be crucial for various reasons, such as drug testing, avoiding harmful side effects, and ensuring the medication's optimal therapeutic benefits. Adderall is a prescription medication that should only be used under the supervision of a licensed medical professional. It has a high potential for abuse and can be habit-forming, leading to dependence and addiction. If you have concerns about Adderall or its effects on your system, speak with your doctor. Adderall half-life. When it comes to how long does Adderall stay in your system, Adderall's half-life must be considered. The half-life of Adderall is 10 hours. In other words, 10 hours after ingestion of the drug, half of it leaves your body. If you took 10 milligrams of Adderall at 12 a.m., only 5 milligrams will remain by 10 a.m. By 8 p.m., it drops to just 2.5 milligrams. But how long does Adderall stay in your system, and how long does it take for Adderall to leave your system altogether? It takes around 5.5 half-lives, or a little over 2 days. That's right, in just over 48 hours, your body will be Adderall-free. However, if you've been taking the medication frequently and at high doses, it's recommended to allow a more extended period of about 7 days to fully clear from your system. How long does Adderall stay in your system and drug test types? Adderall, amphetamine, can be detected in drug tests for different amounts of time depending on the type of drug test used. Here are some Adderall drug test duration guidelines. Urine test. Adderall can usually be detected in urine for 2-4 days after use, but sometimes for as long as a week or more, especially with higher doses or chronic use. Blood test. Adderall can be detected in blood for up to 24-46 hours after use, but it can be seen for more extended periods in heavy users. Saliva test. Adderall can be detected in saliva for up to 48 hours after use. Hair test. Adderall can be detected in hair for up to 90 days or more after use, depending on the length of hair tested. How long does Adderall stay in your system? Adderall drug test durations are subject to multiple factors that can extend positive test results for the presence of the drug. Intentional use of Adderall without a valid prescription is illegal. Testing positive for Adderall without a valid prescription can lead to damaging consequences, including legal matters, loss of employment, and other harmful effects on one's life. How long does Adderall stay in your system? Factors. The length of time that Adderall, amphetamine, stays in your system depends on several factors, including dosage, frequency of use, health status, type of drug test used, individual metabolism, and sensitivity to the drug. Adderall test results can also be influenced by personal factors such as age, weight, liver function, and other health conditions. So, how long does Adderall stay in your system for? Adderall drug test timeframes are general estimates. The exact amount of time Adderall can be detected in your system will vary. It's always best to speak with a medical professional if you have any concerns or questions about drug testing. Is Adderall addicting? How addictive is Adderall? While Adderall is a prescription medication, its misuse can lead to addiction, overdose, and severe adverse effects such as cardiovascular diseases, unhealthy weight loss, and psychotic symptoms. If you or someone you know has become addicted to Adderall, seeking professional treatment is crucial. The We Level Up Treatment Center Network, a top nationally recognized Adderall addiction program, can help with Adderall addiction treatment. Adderall is classified as a Schedule II controlled substance by the United States Drug Enforcement Administration, DEA, due to its high potential for abuse and addiction. Adderall is a prescription medication that has unfortunately become abused, leading to addiction and potentially fatal consequences when taken in excess. So, how long does Adderall stay in your system? Is Adderall addictive to most people? Adderall works by increasing neurotransmitters in the brain, such as dopamine and norepinephrine, which can improve attention, focus, and alertness. However, these effects can also make Adderall highly addictive, particularly if misused or used recreationally. How addictive Adderall is can vary depending on individual factors such as past addiction history, dosage, and frequency of use. However, when Adderall is taken as prescribed by a healthcare provider, the risk of addiction is relatively low. Some signs of Adderall addiction may include using more Adderall than prescribed or taking it more frequently, difficulty quitting or reducing the use of Adderall despite adverse consequences, intense cravings for the drug, taking Adderall for non-medical reasons or continuing its use after it. Does Adderall build up in your system? Adderall can build up in your system over time, especially if you take it regularly or at higher doses than prescribed. The drug has a half-life of approximately 10 hours, meaning it takes around 10 hours for the body to eliminate half of the drug's dose. However, the remaining half can take another 10 hours to metabolize, and so on, creating a buildup effect if the medication is taken consistently over an extended period. As for, does Adderall XR build up in your system? Adderall XR, extended release, is designed to release the medication gradually throughout the day. Generally, a dose of Adderall XR can last up to 10 hours. After that time, the drug will be slowly metabolized and eliminated from the body within 48-72 hours. However, the drug can be detected more often in certain drug tests. Where the medication is taken on an ongoing basis, it can create a buildup effect over an extended time. Factors determining how long does Adderall stay in your system include individual metabolism, dosage, and frequency of use can influence how much Adderall builds up in the system. For example, people with slower metabolisms may experience a more significant buildup effect than those with faster metabolisms. Similarly, taking higher doses of Adderall or using the medication more frequently can lead to a faster drug buildup in the system. The buildup effect of Adderall can have both positive and negative implications. On the one hand, regular medication use can lead to an increased therapeutic effect, helping people with ADHD or narcolepsy better manage their symptoms. On the other hand, a buildup of the drug can also increase the risk of negative side effects such as insomnia, headaches, and digestive issues. If you are concerned about the buildup effect of Adderall in your system, it is crucial to speak with your healthcare provider. They can assess your situation and recommend the best course of action, which may include adjusting your dosage, frequency of use, or switching to an alternative medication. Additionally, it is essential to follow your healthcare provider's instructions regarding the use of Adderall and report any adverse side effects promptly. How long does Adderall withdrawal last? Adderall withdrawal can vary depending on several factors, including the individual's duration, dosage, frequency, and overall physical and mental health. Generally, Adderall withdrawal symptoms can start within a few hours to a few days after discontinuing the medication and may last for several weeks or months. Common withdrawal symptoms may include fatigue, irritability, depression, anxiety, difficulty concentrating, increased appetite, and sleep disturbances. The severity and duration of these symptoms can vary from person to person. The duration of the high or euphoric effects of Adderall can vary depending on factors such as the individual's metabolism, tolerance, dosage, and the form of the medication, immediate release or extended release. Typically, the intense euphoric effects of Adderall peak within a few hours of taking the medication and can last for 4-6 hours. The misuse or recreational use of Adderall, seeking a high or euphoria, is not safe or advised. Adderall is a prescription medication used to treat attention deficit hyperactivity disorder, ADHD, and narcolepsy. And its misuse can lead to serious health risks and potential addiction. If you have concerns about using Adderall or seek a high from the medication, speak to a We Level Up Adderall misuse professional. They can provide guidance, support, and appropriate treatment options based on your needs. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.